We welcome the United Nations Commission on Narcotics Drugs to remove cannabis from the Schedule 4 of the 1961 Convention on Narcotics Drugs, where it was clubbed together with dangerous and addictive opioids like heroin. And we laud the Indian government's extended support to the scientific and medical revival of the cannabis plant, something that is intrinsically woven with our cultural mores and finds its sanctum in our Vedas as one of the life-nourishing plants. Cannabis is among the earliest plants known to mankind, where through its religious and its overlapping health-healing practices earned its place among the sacred medicinal plants and rightly hailed by the Atharva Veda as one of the 5 sacred plants. Once again, we hail this long-awaited decision that clearly paves the way for scientific revival of this ancient cannabis plant and appeal to our government to allow clinical research of the cannabis plant as a whole to understand and realize its full potential. There is enough evidence for the anticonvulsant properties of the different cannabinoids, mainly THC, that's tetrahydrocannabinol, and cannabidiol, that's CBD. And this warrants more clinical research in the direction of treating seizure disorders, especially seizure disorders that are intractable in nature, and also those that are of non-epileptic psychogenic origin. In light of the abundance of cannabinoid receptors in the brain, especially in areas associated with Parkinson's disease and Huntington's disease, the role of cannabis is worth the clinical research, and given the limited currently available therapeutic options and side effects and the inconsistent medical evidence associated with treating neurodegenerative diseases like dementia, it makes sense to study the many effects cannabinoids might have, since its clear role of the 70 different chemical compounds that cannabis has clearly not been elucidated, and it needs thorough in-depth studies in detail. Research interests should focus on the clinical effectiveness of the medical cannabis for the treatment of dementia, as well as in setting up of evidence-based guidelines for the use of medical cannabis for the clinical populations comprising of epilepsy, the movement disorders, and a vast array of dementias from vascular dementia to Huntington's disease and dementias associated with Parkinson's disease, and the most debilitating of all, the dementias of the Alzheimer's type. We need to extend research to understand the therapeutic potential of cannabis for a wide range of psychological disorders, from severe anxiety to major depressive disorders. And given the growing popularity in the use of cannabinoid-based medicines for alleviating mood and anxiety, and a direct link with the endocannabinoid system in the brain, further research in this field qualifies as the need of the hour.